Hello everyone and welcome back to the Melanin Initiative. This is season 3 and this is also Nurses Week, so happy Nurses Week to all of our fellow nurses.
Happy Nurses Week, ladies.
Yes!
Happy Nurses Week. Yay! And our 1-year anniversary.
Yeah.
Yes!
We're doing big things.
Shout out to us.
And to you guys for supporting us. We really appreciate it.
Well, let's get started. So, in healthcare, there is often too much information and not enough time. So here at the Melanin Initiative, we avoid TMI by breaking things down into language that you can understand. We create a safe space for you to ask your questions and to share our nursing perspective without taking too much of your time. Today, our episode is all about weight management. We'll be discussing the current state of weight management in the United States and throughout our lifespan, the differences between underweight, normal weight, obesity, and overweight and morbid obesity, genetics and risk factors for obesity, complications associated with being overweight, current trends and weight management, the most popular medications that are being prescribed, how to get those prescriptions, side effects of the medications, the length of your treatment, as well as the black market as it relates to weight management medication. If you're new here, welcome to the Melanin Initiative. I am Geraldine and one of your co-hosts here at the Melanin Initiative, along with Alicia and Kimberly. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about the ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. By watching on YouTube or listening to your favorite podcast app, we hope you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. If you haven't already, please subscribe so you can be notified when we release a new episode. Thumbs up the video and leave a comment or two. It helps us help you. It also shows YouTube that this content is valuable and helps to make sure YouTube shows our content so that to those that need to hear it. As a disclaimer, this show is for educational purposes only. The opinions expressed are our opinions alone. They are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency, you can call 988. So to get started, I'll pass things over to Alicia.
Thank you. So as Geraldine told you all, we will be discussing weight management today. I think this is really important. In our past 2 seasons, a lot of the things that we talked about, one of the things that affected that was your weight and your lifestyle and diet and exercise and all those good things that affect weight. So as we usually do, we're going to start with a couple of statistics to get us going. So the current state of weight management in the United States and throughout our lifespan, according to the Centers for Disease Control and Prevention, the average weight for adults in the United States is 197.9 pounds for men and 170.5 pounds for women. However, it's important to know that these are just averages and that there are a wide range of weights and what we consider normal. The average weight of people in the United States changes throughout their lives. For example, the average weight of a 2-year-old is 29 pounds. Probably not shocking to hear that. While the average weight of a 65-year-old is about 175 pounds. There are many factors that contribute to these changes, including genetics, diet, and lifestyle. So Kimberly, let's talk about, what does it mean to be normal weight, or what should we be, how can we classify these things?
Thank you, Alicia. First of all, I love the earrings.
Oh, thank you.
And I love the fact that you referenced so many of our first 2 seasons, because we do talk about the same things over and over again, with one of those things being weight, which in large part is something we have a lot of control over. And so when we talk about weight management, we have guidelines to follow, and most of those guidelines have numerical values. And so when it comes to weight management in particular, we use a guideline called the Body Mass Index, or BMI, which I'm sure most of you are familiar with. And so that was first introduced in the early 19th century by a Belgian named Mr. Lambert. He was actually a mathematician, not a physician, and he used this formula to give a quick and easy way to measure the degree of obesity, which shows us this has been around for some time, of the general population to assist the government in allocating resources. And so, like Alicia said, we have normal weight. And so what we'll do in the description box is we're going to put the chart and information so you can see that. I think for most of the public, it really doesn't matter, the numbers, right?
Yeah.
But for us, we do use them as a guideline because we need guidance or structure to determine like if people need to eat more, if they're eating too much, and if they are candidates for certain kinds of treatment. So with underweight, typically those people, so I'll think of two people. We have those people who participate in physical, in competitions. They tend to be underweight, and particularly in their fat percentage, right? We're usually not doing too much for them unless they come into complications. And one of the things I usually hear is like if they keep doing those competitions, it kind of starts to weigh on their liver, like the up and down weight management. Then we have our normal weight. For most of those people, we're not really doing anything. We usually consider that the barometer or the ideal place where everybody's trying to go. Now when we get into overweight and obesity, I think that's where most of us usually sit. And it comes as a surprise for a lot of us because we think we look fine, right? And not only do we think we look fine, but by looking in the mirror, when we compare ourselves, particularly in Black and brown communities, we really think we look fine, right? We like the weight in certain places, and that tends to tip the scale into that overweight area. And then when we get into overweight, and so when you're overweight, that puts you at risk for all the things we've talked about: diabetes, high blood pressure, high cholesterol, heart attack, stroke. It can cause pain on your joints. It can increase your risk for sleep apnea. Certainly go back and watch all of those episodes. So it can affect your quality of life, your ability to breathe, especially once we start tipping into that obesity and even the morbid obesity, right? And I think we would mostly agree the people who start to get in that obesity and morbid obesity are looking at a lot of specialists, right? Cardiology, pulmonology. It's a lot of breathing problems once you start to get into that weight. And so that's like the main thing we want to point out, because we're going to get into some medications and treatments. And while you might not fit into your genes for your upcoming trip, you might not qualify for some of these more trendy medications. You really do have to kind of hit these certain numbers, especially when you start talking about surgery, right? So that's the main thing we want to emphasize with the BMI is like we use it for guidance. I don't know that the public would really use it that much, and so that's why we're just going to put that in the description box. But it is important to know your weight. Like it actually does, it does matter because of all those things that we mentioned. And we want to just emphasize what we've pretty much been our main platform is the importance of moving and watching what you eat. And reading those labels is going to be a big part of, where you fit in those scales. And a lot of, even though we are kind of focusing on overweight in this particular episode, and I think in our country, in healthcare, we do see a lot of people who are underweight, right? And a lot of those people feel left out, even when they're talking to like their trainers. You'll see them in comments saying, what about those of us who actually want to gain weight? I think they're often left out of the conversation. And particularly when you're in like a acute chronic setting, we're seeing those people who are more at risk for things like prolonged wound healing or skin healing, maybe even after surgery, right? And so we tend to get a nutritionist to come in, look at their lab work, add on supplements, and that's typically how we treat those patients. And while a lot of our life we want you to lose weight, as we get older, we switch that conversation. Actually, the more cushion you have, it tends to make you look older. It does help when you fall. You have that extra padding between you and the ground. And so that fracture, that injury tends to be less traumatic. And a lot of times you'll look younger, right? Because you'll have that fullness of face. And so the conversation actually changes as we get older. I think that's the main thing we want to point out.
If I could add, I think too, people find the BMI to just be controversial at times because it doesn't account for age or muscle mass or things like that. So an individual that has a lot of muscle can have the same BMI as someone that has more fat. So that sometimes that can be controversial in why it's not always discussed and utilized with our patients.
And I think in standard medicine, it is pretty typical, get on a scale and we just
Weight,
look at that
yeah,
number.
yeah.
But when you start to look at like your professional athletes or those weekend warriors, and they have these specialty clinics where they're looking at everything from how much water is being stored, the actual fat, where it's located. So it can get a little more nitty gritty. And so we just wanted to kind of just talk about how we utilize it in healthcare. But of course, speaking with your primary care provider will be the best course of action to know exactly what your goal should be at whatever particular phase you are in life.
That's all great information. I like that you pointed out visiting your primary care provider as well, because although we tend to focus on the BMI, we also like to look at like labs and make sure that you're healthy in that sense, that your cholesterol levels are where they should be. Even if you may be overweight, but blood work is healthy, so we may not have to like put you on necessarily like medications or anything like that. We'd recommend doing other lifestyle modifications like diet and exercise.
And we can point out kind of what might be contributing to that.
Sure.
Right? It might be sleep. Sleep is a huge factor when it comes to sleep. And like retaining fluid. It might be like your medication needs to be adjusted.
Right.
Right? So it's not just getting on the scale and how you look. There might be something else going on. So yeah, great point.
One thing that can affect or increase your risk for obesity is genetics. Although it's not the main thing, it is possible. Several genes that have been linked. There are several genes that have been linked to obesity, and these genes can affect a person's metabolism, their appetite, and their body composition. But it is important to note that genetics are not the only factor that determines if someone will become obese. And if they do have if a person does have a genetic predisposition to being obese, it's not like the end of their story. They can definitely help not becoming obese by maintaining a healthy weight, by making healthy lifestyle choices. Other factors that are non-genetic related that can affect your risk for obesity is diet and how your diet is, lack of exercise. These play significant roles in your risk for obesity.
So, we know, and we've talked about this many times here on the Melanin Initiative, that there are complications that can be associated with being overweight or obese, or morbid or obese. So obesity is associated with a number of serious health conditions, and we talked about many of these before: health disease, stroke, type 2 diabetes, and some types of cancers. So in addition to these chronic diseases, obesity can also lead to a number of other complications. And we may not, think about these as often. So sleep apnea, fatty liver disease. And fatty liver disease means that you have fat inside of your liver that can over time affect its function and cause injury to that liver. So people who drink too much alcohol may also have fat in their liver, but that's a different but that condition is different from fatty liver disease. You could also end up with kidney disease, arthritis, oh my gosh, depression, and anxiety. Yes, so I will say, we're here on the camera. I'm obviously not the skinniest model in the world, but I will say as I started to gain weight, I feel I'm more achy. And I was devastated when my primary care provider put me on cholesterol medicine. I just couldn't believe it. Me, the nurse, taking cholesterol medicine. This is very real. It affects anybody and everybody, but it's nothing to be afraid of. So once you can do something about it. So let's talk about some current trends.
Well, before we do that, it's interesting that you brought up the whole cholesterol thing, because I think as I got older, I've been gaining not a lot of weight, but I've been gaining more weight, and it has been affecting my cholesterol. So I'm not at the point of meds yet. Hopefully, I have my next primary care visit soon, so hopefully my numbers are good. But the cholesterol is a huge part of something that affects your weight, as well as being pre-diabetic. Obesity actually is a risk factor for diabetes, as Alicia mentioned earlier. So as far as current trends in weight management, so there are traditional methods of weight management, which includes diet and exercise, which we love to stress in the primary care field. When I get patients coming into the clinic and we're, doing their annual visits or just their checkups for certain things, that's the main thing that I stress, because I always tell them, ideally, we don't want you on medications if we don't have to put you on medications, because medications have side effects. So, but if you need it, you need it, and we definitely will put you on it, but ideally we take the steps necessary to prevent the need for medications. There's also use of diabetic medication for weight loss, such as metformin. When you hear metformin is typically used for type 2 diabetics, but it can be used for patients that are not formally diagnosed with diabetes, but they may have some insulin resistance, which can increase their chances for being unable to lose weight. So we put them on those medications. And metformin is an oral medication. It's a pill. Bariatric surgery is also a current trend in weight management. It's an operation intended for people who have obesity and need to lose weight, but they have not been able to do so through other means, such as the dieting and exercise. I actually had a family member that had a bariatric surgery years ago, and it actually helped. And she told me that basically what they did was they put a band on the stomach so that she gets full a lot quicker, so she eats less. So that's one of the benefits of the bariatric surgery, and it was able to help her lose a lot of weight.
I think it's important to point out sometimes people get a lot of criticism for choosing bariatric surgery, right? And so they do have to meet certain criteria. Like they have to lose weight, like they do have to, usually it's 100 pounds or something. I don't know if there's a number, but they usually have a goal that they have to meet before then. And I think it's important to be empathetic towards, that situation, because there could be other reasons. They may have tried everything, literally. It might be hormone balances, it might be life-sustaining medications like chronic steroids, right? And so I think it's important to know that it's not, like, I think a lot of times people think they're giving up, right? Or they're taking the easy way, and it is definitely not easy. It's not cheap, and it's not fast, and it has side effects, right?
Too,
I think anytime we see people having abdominal surgery, we see them again and again, right? Because there's so many complications after those kind of surgical procedures, and they're aware that that's happening, and they're just saying that they think the benefits outweigh the risks because of what they've been experiencing.
Yeah.
I also know someone that had bariatric surgery, and I didn't know they actually put her in classes. Like she had to, she had to take a class, and it wasn't like a online like quick click like she was in classes, so they wanted to also mentally prepare her for what the diet would be like, and is she actually mentally ready for this type of lifestyle change, because you can't get the surgery and then do what you were doing before.
Absolutely.
That's just, it wouldn't be effective. So they I'd say good surgeons are going to take the time to really make sure that you're also mentally prepared for that kind of change.
Absolutely.
Good point.
Other examples of weight loss management procedures that can be done include lipo and tummy tucks, which is more on the, I guess it's considered like cosmetic, but it still helps patients lose weight.
Yeah, so the whole inspiration for this episode is all the popular medications out there, and there's a long list of them, and I think it's growing by the day. But some popular ones that you've probably heard of are Wegovy, or also known as semaglutide, Ozempic, Mounjaro, which was FDA approved in 2022, Zepbound. There's a whole list of them. We're going to put some resources in the description box for you. We know they're quite popular amongst our colleagues. Right? Because they're helping people get off those diabetic medications, those high blood pressure pills, those high cholesterol medications. It's helping relieve their pain. All the things we mentioned today. And so I know from our experience, it's been positively received. It's not without side effects, right?
Of course. Of course.
And we're going to get into that.
And I think, it's important to know some of these too were, they weren't originally prescribed for weight loss management. I'm not sure if all of them, we're still learning a lot about them ourselves, but some of them for sure were intended for other purposes, maybe diabetes management, and then a side effect of that was weight loss, right? So then they're like, oh, well, let's see if we can just use it for weight loss. So that's a lot. We can get more into that in other episodes, but there are other medications that was intended for one use and then ended up being another, right?
Yeah.
So if you were interested in getting some of these medications, I always say, and what do we say here in the Melanin Initiative? You should start with your primary care provider, right? Having a conversation with them. It maybe you could use some diabetic management, and a side effect of that would be weight loss, so that could be helpful. And then there are also other places such as med spas or weight loss clinics. I still think that if you are going to go down the med spa or the weight loss clinic route, you should still consult with your primary care provider, just to make sure that there are no, the word would be used as contraindications, or something that if you start taking these meds, they could affect other medications that you take. You want to make sure that there's no issue with that. And then there's also the option of meeting with someone via camera in the telehealth field.
Excellent. Yeah.
So some side effects of these medications could be some GI. Most commonly when I hear about side effects from these medications, it's the stomach and the GI system. So it could be nausea and vomiting, acid reflux, bloating, stomach cramps, diarrhea, and or constipation. I'm also hearing a lot of liver and pancreas issues that come up. You could have an increased heart rate and blood pressure, trouble sleeping or some sleep disturbances, dry mouth, headaches, dizziness, lightheadedness, and fatigue. I mean, everything we take has risk, but this is why you should consult with your primary care provider, really, to see if this is going to align with your goals. We're not saying you will get these things, but it's always a possibility. So it's just good to give you all the information up front, right?
Right. And as far as like length of treatment, it really all depends on how long it just depends on whether the drug is actually helping you lose weight, and helping you lose it and keep it off. And it also depends on whether you are experiencing those side effects that Alicia mentioned, because we have to weigh the benefits versus the risk. If it's causing some severe adverse effects, your primary care provider or whoever your prescribing provider will more than likely either change your dose, lower your dose, or take you off of it altogether. Because at the end of the day, if it's going to potentially kill you, we don't want you on it, or if it causes any life-threatening issues, we obviously wouldn't want you to take the medication, and we at that point try to find an alternate route. A lot of things, another topic that's commonly discussed around these medications is the cost. Most insurances won't cover it for like weight management purposes. There are some that will, and it just all depends on policies and what insurance you have. A lot of these medications, as we previously stated, are usually used for diabetes, and if it's being prescribed for diabetes, your insurance more than likely will cover it. But if it's for weight management specifically, then a lot of times you have to pay out of pocket for it, and it can cost anywhere from $1,000 to $1,300 per month. So it can be pretty pricey. So once again, this is a discussion that you should have with your doctor to see if it is going to be beneficial to you health-wise and financially.
One other thing I wanted to mention too is that while these medications have been prescribed for diabetes for a while, we are still learning what this looks like long term for the off-label use of weight management. So there's not a lot of research out there of what this looks like 20 years, 30 years, 40 years, 50 years plus for weight management. So there's definitely more to come, and we're all health buffs here, interested in research, and so we're interested to see where this goes, and in 20 years we'll come back and tell you.
Excellent. We'll wrap it up.
Yeah. I mean, did you? I know we talked. Did you want to talk about the black market at all?
Oh yeah, so we did. During our research, and I think Alicia personally had a personal experience with finding out that while we mentioned these reputable places where you can get the meds, there is the black market, which is selling them at a lower cost. Of course, as clinicians, our advice is going to be one thing: you don't know what's really in that bottle, and if it comes at a lower cost, you usually get what you pay for. So our advice would be to stay away from those. And if cost really is an issue, really just talk to your primary care provider and see how they can best support you. But if you're finding it on the street or some other route that's not being prescribed by someone who's licensed, we would highly recommend not to use it.
Great point. So we've given you a lot to think about today in the realm of weight management. So we started our conversation talking about current trends in healthcare. We talked about some complications, some popular medications that are being described, those side effects, and staying off the black market.
Please stay off the black market.
Please. So that's the end of our episode.
Yeah,
So
season 3.
Yes.
Yeah, so I'm not sure when you'll see this episode because we're also releasing our new series on 73 questions. So at some point in this week, you'll see this or that first. And we are still kind of playing around with the new scheduling. So our new show, for Nurses Week, we're releasing shows every week, every day. As far as the other ones, we might stick to the Tuesday schedule. We might move to Sunday since everyone's at home and they have extra time. So stay tuned. Make sure you subscribe so you can find out what we're going to do in terms of our new scheduling.
Absolutely. And then please stay connected with us. You can email us your questions or show ideas at tmi.melanin@gmail.com. If you haven't already, subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Please share the show with your friends. Rate the Apple Podcast, and Spotify, and leave a comment. It really helps the show get more support and get the message out there to those that need it. You can find all of our social media links and a list of resources related to our conversation today in the description box. And we release a new show weekly. We may be changing the dates, but for right now, it's TMI Tuesdays at 10 on YouTube and all your favorite podcast apps. Follow, like, and share our content with all your friends. Thank you for watching.
Thank you, everyone.
Thank you.
I hope you enjoy our new studio.
Yeah.
Yeah, we had some friends on the other side, so if you hear any of that noise, we do apologize. And yeah, thank you for watching. We'll see you next time.
Yeah.
Bye.